Lord Shila Narayana Super Speciality Hospital and Maharishi Chakrabarti Foundation. Today I'll be talking about the treatment or the approach to treatment of lymphoma. Lymphoma is one of the most treatable and curable condition under the sun. Of all the malignancies, if I were to choose one today, I would definitely choose a lymphoma. Now, why is that? Traditionally, cancers or solid organ cancers, to be precise, are dependent on resectability or the ability of a surgeon to completely get rid of the cancer through a scalpel or a knife. But lymphoma, even though it might reside in an organ, it might be widespread in the body, or it may be in any form or shape, can be cured with certain drugs, with or without radiation therapy. Now, that is what puts lymphoma in a unique position. Broadly speaking, there are two types of lymphoma: Hodgkin's lymphoma and non-Hodgkin's lymphoma. Hodgkin's lymphoma is probably the most curable of all the cancers across all the age groups. Simple chemotherapy regimens, if the disease is at an early stage, would cure nearly 90-95% of the patients with a short course of chemotherapy. And if the disease is very advanced, maybe the initial response rate might come down to 70%, but with the newer drugs which are around, even if the disease comes back or it doesn't fully respond with the first line of treatment, it will eventually respond. Now, coming to the other variety, which is a dump of all the other lymphomas, called non-Hodgkin's lymphoma. There are various types, but the most popular or the most common type of it is called diffuse large B-cell lymphoma. Now, the treatment of diffuse large B-cell lymphoma is completely revolutionized over the last couple of decades with the use of a drug called rituximab, or a specific antibody which targets the cancer cells. Now, with this, again, like Hodgkin's, most of these diffuse large B-cell lymphomas are curable with the combination of rituximab and chemotherapy. But saying that, our understanding of this disease has increased vastly. We know that there are several types of this diffuse large B-cell lymphoma, and there are certain types which don't respond that well to chemotherapy. And there are other ways to approach this particular subset of lymphoma. Now, because this is a very common type of lymphoma, there has been a huge investment in drug development. And, as we speak, there might be some 1,000 molecules which are being explored in the development of treatment of various types of lymphoma. But saying that, majority of these drugs are still not available for clinical use, and particularly in India, we are grossly deficient in the newer molecules. So, what are the options for patients who do not respond to chemotherapy, or the disease comes back after chemotherapy? There are two options. One is what is now popularly called a CAR T-cell therapy, at least for B-cell lymphomas, where the patient's own lymphocytes are taken out and they are processed or genetically engineered to target the cancer cells, and they're given back. It's called CAR T-cell therapy. Again, it's not available in our country, but it's sort of picking up in the West. It's not without its toxicities. What we have been doing for the last 2 or 3 decades for patients of lymphoma who do not respond to chemotherapy or they relapse after chemotherapy is autologous or allogenic bone marrow transplantation. In the past 10 years, we have developed particular newer forms of allogenic transplantation called haploidentical transplantation, with certain drugs which are used to boost the immune system, which we develop after the transplantation, and we have had some excellent results with the haploidentical transplantation in both Hodgkin's as well as non-Hodgkin's lymphoma. So I'll sum it up by saying that you know, lymphoma, whether it's Hodgkin's or non-Hodgkin's, there is excellent scope for inducing a cure in all forms of this disease. Thank you.